All right. Well, more and more people are joining, but since it is 1 o'clock, I would like to start this webinar. This is already the 5th webinar in a series on the impact of COVID-19 on our efforts to end FGM. I'm very, very excited about today's webinar since we have amazing speakers. Here you see an overview of the speakers that we have today. We have activists from Nigeria, from Sierra Leone, from the Gambia. And it's really, really nice, and it's my pleasure to cooperate today with AmplifyChange. So a big thank you also to Alita Osborne, who contacted me after the previous webinar and said, well, I think it's a very good idea to focus the next one on the situation in West Africa. And I couldn't agree more. We had a webinar about the situation in Tanzania, afterwards about the situation in Kenya. Then we had a webinar about Asia. And the last webinar was about the situation of the youth. So the role of the youth in ending FGM in times of COVID-19. And I'm therefore very, very excited to have today 3 experts who are willing to share with us their thoughts on how and their experiences on how COVID-19 is impacting their work. Now, this is the outline of today's webinar. So I will give a short introduction. Afterwards, Alita will give an introduction and an overview of what AmplifyChange is currently doing in terms of FGM at times of COVID-19. Chioma Ike will give a presentation about the situation in Nigeria. Then Sarian Kamara will share with us the situation in Sierra Leone and the work of her NGO in the field and how they are dealing with the situation at this very moment. And then we have Oumie Sissokho from the Gambia, who will share with us the situation in the Gambia. And then we have time for a Q&A session. So to all the participants, feel free to ask any questions that you have in the chat box. You don't necessarily need to wait for the Q&A session. Please share with us your thoughts, any questions that you might have. For those of you who participated in the previous webinars, you know that this is a very interactive platform. So I highly encourage big discussions. Feel free to ask anything that you want to know. And I'm really looking forward to the next hour, maximum an hour and a half. So I saw on the list of participants today that we do have quite some new people, so people who haven't participated in the previous 4 webinars. So I thought it might be good to look back just a few seconds. So I already said which themes we discussed in the previous webinars. So Tanzania, Kenya, Asia, the role of the youth, and today we are discussing the situation in West Africa. Now, I would like to emphasize that all PowerPoint slides, but also all the recordings can be found on my website, and also the PowerPoint slides and the recording of this webinar will be shared with all the participants. Now, if I look back, we had over 350 participants from all over the world attending this webinar series. Here I put a list of countries where people came from. We decided also to put the link of the recording on YouTube, and we had over 500 views already. So that is really, really nice. It's also very heartwarming to receive so many emails from you stating that you find the webinars inspiring, that it even also gives a feeling of bringing together us activists, experts in the field of FGM at times when we are at home, when social distancing is the norm. So I'm very happy that I could and can contribute to that. The people that participate are mostly activists, people working for NGOs, but also representatives of UN agencies, representatives of governments, and universities. Now, what have we learned? What I did during the very first webinar is to ask you to share your knowledge and to share information. So I asked you 4 questions, namely, what potential risks do you see? What opportunities do you see? What are the challenges that you are currently facing due to COVID-19? And what are the solutions for these challenges? And I was so happy to receive so many responses from so many of you. And I collected all those responses. I also planned one-on-one Zoom meetings. And I collected all the information in this 8-pager that I also shared with everybody. But apart from that, what I did the end of June is that I submitted a report to the Special Rapporteur on Violence Against Women. So here on this slide, you see a call for submissions of the Special Rapporteur. And she asked for information for a report that she's going to submit in October to the General Assembly. And I decided to summarize all the information that we gathered during the past 4 webinars in one report and to submit it to her. And I was very happy to receive an email from the Office of the High Commissioner of Human Rights confirming that my report has been sent to the Special Rapporteur on Violence Against Women. It will be published on the website of the UN Human Rights Office of the High Commissioner, but I also published it already on my website. So if you would like to read it, you can download it following this link. Now, what are the main outcomes of the webinars that have been organized? What we see is, first of all, an increased risk of FGM in the African context. Schools are closed, we have social distancing requirements, we have a lockdown in many countries. And this is the case, especially in East Africa, we see an increase of child marriage. And of course, in many countries, FGM is a prerequisite for child marriage. So we also see an increase in FGM. Now, on the other hand, when we organized the webinar about COVID-19 and FGM in Asia, we saw a reduction of FGM cases. And what we also learned is that there are important lessons to be learned from Ebola. And this is why I am very excited also about today's webinar, because I have also myself a few questions. First of all, is there also an increased risk of FGM in West Africa, like we see in East Africa? I would love to hear from the panelists, their experiences and their views. Is there, and the question comes also from the relationship in Eastern Africa and the link with child marriage. Now, as you can see on the slide here, the age at cutting is much lower in West Africa compared to East Africa. So in Nigeria, for example, 86% of the women are cut before the age of 5. Now, in Sierra Leone, the average age is a bit higher. So 40% of the girls are cut between the age of 10 and 14. And in the Gambia, it is lower again. So this raises the question, is there a link between child marriage and FGM like there is in East Africa? And if not, is there then a decreased or an increased risk of FGM due to COVID-19? And then, of course, Ebola hit hard in West Africa. So you have experiences in relation to Ebola as well. I've heard from Sarian that there is a government ban currently in Sierra Leone and that the government is taking action. Now, I would love to hear like how that works, whether there is indeed a temporary halt to FGM and what the impact is of those rules and regulations. So that was my introduction. I would like to give the floor now to Alethea. She is a strategic advisor at AmplifyChange, and I welcome you to present and to introduce the work of AmplifyChange. And thank you again for your collaboration. It has been great. The floor is yours. Alethea, are you still with us? If not, maybe she has a problem with the internet. Well, we could move to the very first presentation then. Chioma, do you perhaps want to take the floor? You can unmute yourself.
Absolutely, Anne-Marie.
Okay, thank you. Maybe you could introduce yourself to the audience as well.
Okay. Hello, everyone. My name is Chioma Ike. I hope you all can hear me.
Yes, we can hear you very clearly. Thank you.
Awesome. I'm the executive director at Circuit Pointe, and today I'll be speaking to you about what's happening in Nigeria with regards to the pandemic, how we have had to adapt as an organization, our main challenge at the moment, and the opportunities we have identified. Next slide, please. Now, on this slide are a few facts about Circuit Pointe. Currently, we're working in 25 communities in Imo and Ebonyi states where FGM type 4 is practiced on female babies within 0 to 10 days of birth. Now, in the last 6 months, the ripple effects of COVID-19 are attempting to erode our hard wins at both organization and community levels. Circuit Pointe was established in 2015. We operate in Southeast Nigeria. We're focused on women and girls' empowerment and rights movement. Now, moving to the next slide, I'll be talking about the impact of COVID-19 in Nigeria. Now, with the stay-at-home rule that was enforced during the nationwide lockdown in March of this year, we recorded a massive increase in cases of FGM type 4. Now, this is because in addition to traditional birth attendants, grandmothers, mothers-in-law, and even mothers themselves now perform FGM type 4. So the fact that people could not visit, the fact that monitoring groups couldn't track or monitor pregnant women and nursing mothers, paved way for many of these households to perform FGM away from public scrutiny and on female babies who are unable to resist. Unfortunately, the ban on interstate travel prevented our team from visiting these communities, and the restrictions on public gatherings disrupted the People's Assembly that was previously scheduled. As at last month, the Nigerian government proposed a 43% cut to primary healthcare services at a time when women and girls need these services the most, and despite the rising number of confirmed cases of COVID-19 in Nigeria. Now, what does that mean? This means that this proposed cut, rather, could affect immunization, it could affect childcare, maternal health care, and even family planning. Now, this means that pregnant women and nursing mothers will turn back to traditional birth attendants who offer at-home delivery services and FGM as a package. This means cases of infantile FGM will grow at an exponential rate. Now, on the next slide, I'll be talking about how COVID-19 has affected us as an organization. In addition to COVID-19 affecting our work in the community, at community level, at organization level rather, our staff had to operate remotely. Our overhead costs went up 100% because we needed to create a digital workspace. Also, we received so many requests for salary advance due to panic buying and spike in prices of commodities. Our planned activities were postponed, and our delivery model in general was disrupted. On the next slide, I'll be talking about our response to the ripple effects of COVID-19. Now, as an organization, we just had to respond to these ripple effects of COVID-19. We have taken 3 proactive measures to protect our staff and the communities we serve. First, we strengthened our capacity and adapted our work practices. Now, this entailed bulk upload of project documents to our OneDrive online. We set up collaboration platforms such as Microsoft Teams, and we organized training to ease transition to remote working. Currently, we have staggered our work times for staff and volunteers who are currently working on our projects. Our second action was to include COVID-19 awareness messages in our SMS campaign. So on a weekly basis, we send out SMS blasts to members of these project communities we serve. We educate them on preventive measures, on symptoms, and how to make safety kits, such as facial masks, using locally available materials in their homes. The next thing we did was to reorganize our project schedules. So community-based activities were postponed to Q4 of this year, while we actively engaged in media and technology-based activities, such as airing and FGM-related messages on radio. Furthermore, we have adapted our program delivery model so community-based activities can take place in smaller groups of 20s or less. And lastly, we have kept our donors informed of what is happening via email. In the midst of all that has happened, we've identified new opportunities which we call the 3 C's of COVID-19: connection, communication, and collaboration. In terms of communication, we're working towards a toll-free line to encourage community members to whistleblow to prevent FGM or to report cases of FGM. We'll also be addressing resultant issues of COVID-19, such as gender-based violence, by providing counseling services, support, and information to women and girls. For collaboration, with the probability that there will be a budget cut and the possibility that more pregnant women will opt for at-home delivery services, we're taking proactive measures of engaging traditional birth attendants as change agents, so they become capable of influencing their peers, which is other traditional birth attendants, and dissuading mothers from requesting at-home delivery service and FGM as a package. For connection, although the initial cost of setting up a digital workspace was enormous, it was huge, but we're seeing efficiency, we're seeing productivity, we're seeing stability, and we're looking at continuing this path as our new normal. Now, to wrap up my presentation, I will say that my team and I have witnessed firsthand how COVID-19 affects women and girls, women and men especially, differently. It has made inequality and discrimination worse. These are trying times, these are terrible times, but we're not stopping ourselves from going to the forefront. We'll keep pushing until change happens. I want to thank everyone for listening to me. And now I'm happy to hand over to the next speaker, Sarian, or back to you, Anne-Marie.
Yes. Thank you so much. Yes, I'm clapping. I see people clapping too. This was an excellent presentation, Chioma.
Thank you.
Thank you so much for sharing. I have also many questions to you, but
Awesome.
Let's first move to the next speaker.
Okay.
Or Atlita, are you with us? I think you are right now. So I think we can go back to your presentation first.
Yeah, I think so.
Yes.
I apologize. Okay. Can you hear me?
Yes, I can.
Okay. Sorry, I've been working from this office for 4 months and the internet has never crashed. And the one time where I quite need it to work, it decides to go down. So I apologize for that.
Okay.
So I'm just going to do a really short introduction. My name's Alethea Osborne, and I was just going to do an introduction to AmplifyChange and the type of support that we give to projects who are working to end FGMC, and how we've tried to adapt to support our grantees while they adapt during COVID-19, and some of the learnings and trends that we're just about starting to see. So just here's a heat map and some key statistics that give an overview of the support that AmplifyChange has given to FGMC programs. This is cumulative, so it's over the last 5 years. So not all of these grants will be live at the moment, the spread of grants that we have. So while they're all working on FGMC, they are all different. And that while they cumulatively equate €7 million worth of investment, which is about 10% roughly of AmplifyChange's whole portfolio, the vast majority of these are really small grants. They're going directly to civil society organizations, grassroots activists. They're usually organizations who are led by women, led by youth, led by survivors of FGM themselves. They're always registered in country and working with those communities for localized responses to advocate for programs that will push towards ending FGMC in future. And so with that in mind, moving on to the next slide, I would say that the key thing that we've really kept in mind in our response during COVID-19 is to stay as localized and flexible as possible, and to really listen to our grantees and understand what's needed. I think during the first couple of months, there was a real panic about what do you do when your activities that usually go through schools, health centers, work through gatherings and community meetings. You can't travel, you can't bring people together like that. Just reassuring people that it's absolutely fine to take a pause, that projects can be extended and there won't be cost implications. As Chioma mentioned, that for many people there was a need for organizational strengthening and investment in being able to work from home, reassuring employees of hotlines, SMS services to make sure people keep connected. I think as we're moving forward with this, there's been an understanding that while lockdowns might be easing, things are never really going to go quite back to the way they were, and that we need to understand the different trends that have taken place. And whether FGM in certain contexts have gone up or down, it's certainly not going to disappear, and that the real worry is that it's going to be overlooked. I think Chioma said it better than I ever could, but with the current situation and the potential economic downturns, we know that gender inequality will be affected and will get worse, and that there cannot be a discussion around gender inequality that does not have FGMC at the center of that. And so it is more important than ever to ensure that advocates and grassroots organizations are supported to keep their work and keep their voices being heard. We're trying to encourage learning, both in terms of events like this, but also on our website, we have certain how-to guides that have been written by grantees themselves, and some of them really focused initially on how do you work from home, and now they're starting to move forward to, okay, how do we adjust our work plans? How do we adjust our milestones to understand and keep this movement going and make sure that it doesn't get dropped off the agenda? So I'll pause, and again, I apologize for my internet, and I'm so pleased to have some fantastic activists to be able to give their insights, and we'll pass on over to Anne-Marie and Sarian. Thank you very much.
Thank you so much, Alethea, and I couldn't agree more with you. And this was also the reason why I decided to submit something to the Special Rapporteur on Violence Against Women. Because you see that there is a lot of attention on domestic violence, violence in the home at times of COVID-19. But as you say, FGM is a form of gender inequality, and therefore it should also be at the core of all response plans to COVID-19. So I'm very happy to see that AmplifyChange is also allowing that, and also what I think is really important, to be flexible in terms of funding, because the activists on the ground knows much better. I'm going to mute some people, sorry. So the activists on the ground know in times of crisis what is needed most. So now we are going to our next speaker, Sarian. Sarian is a survivor of FGC or FGM. We met a few times during international conferences. It's always a pleasure to work together with you and to hear your experiences. Perhaps I can share with the audience how you also asked questions to your own First Lady about FGM. I think this was amazing. Maybe you've seen the video that was shared on social media. I was the one making that video. So Sarian, the floor is yours. I look forward to hear from you how COVID-19 is impacting your work and how the situation in Sierra Leone at the moment looks like. So Sarian, the floor is yours.
Thank you so much, Anne-Marie. Hello, everyone. Thanks for having us here on this wonderful platform. It's very nice to see everyone, my fellow grantees from AmplifyChange. Yeah, my name is Sarian Kamara. I am the founder and director for Keep the Drums, Lose the Knives, Sierra Leone and UK. I'm going to talk to you quickly today about the impact of COVID-19 in Sierra Leone and in our work to end FGM in Sierra Leone, and how we have adopted to the issues that are arising as a result of COVID. So yes, I will go straight to the impact of COVID-19. As just as in Ebola, all schools were closed in across Sierra Leone, and so that's really bring a big lockdown for not only movements within cities but across cities. So that really affects our work, because most of our work is done in the northern part of Sierra Leone, that is in Makeni. We operate in 7 now 8 communities and villages in Makeni, where we do school activities, and then we organize outreach events for communities. But most of the people we operate with in these communities are like 90% are illiterate, so they cannot read or write, so which makes it difficult for we to be able to deliver our activities, because we have to be on the ground at a grassroots level, because this is how we normally create impact and try to change mindsets across the different communities we work. So government, just like in Ebola, quickly shuts down all schools, and which means our school activities were brought to stop. So we have to quickly re-strategize on how best to reach out to these children and young people and women that we support across the community. So we have to quickly put together a team and a message on COVID, because it was new in Sierra Leone and for everyone across the world. So as we were learning, imagine what it was like for people across these communities we work in, who only sees beyond who cannot see beyond their villages. So we have to create packages and messages, that would fit their communities. It means we have to have a team that will be on the ground with COVID messages, observe social distancing. First of all, it was so difficult to be able to explain to them what is social distancing, so we have to use our experience of the Ebola, to kind of explain to them. The next slide, please. Hello, Anne-Marie, can you hear me? Yes, so as you could see in the pictures, it was very difficult, because normally we as a team, we will merge all communities together, because it's easier for we to educate communities in a way that they understand that other people do this, not only Sierra Leone people, but outside of Sierra Leone as well. So what we do, we merge communities together, sit them and listen to how what is their reasons for practicing FGM, and then we try to educate them and allow them to see reasons to change. But because of the COVID, it was very difficult for me to do that. So we have to reduce the amount of people we will bring together for our outreach event. So as you can see in some of the pictures, we have to have smaller groups, but then we continue to have our discussion, because just like my colleague Chioma said, that they have to change their approach and begin to respond remotely. We were not in our situation. It was difficult for we to be able to continue our work that way. So we have to go on the ground and limit the amount of people we usually bring together to continue our message while observing, social distancing and prevention messages along our FGM campaign. So it was really, really difficult. So we were slow in our action and in our intervention as well because of that reason. So we have to organize one-to-one sessions as well, because in some cases we cannot bring people together because the government of Sierra Leone quickly announced that all gathering more than 100 people should stop. So it was difficult for me to bring communities together in that light. So we were doing it slowly, communities to community, household to household, taking around messages. And before the first lockdown in Sierra Leone, these communities we work in were not even aware of COVID at all until when our team went there to give them the message that there is this pandemic crisis that is around the world and it's in Sierra Leone called COVID-19. So we have to begin to explain to them in the language they understand and just bring examples of what happened during the Ebola crisis. So the Ebola crisis really helped us in passing on our messages as well. So we quickly get for them buckets, teach them how to wash their hands, soaps and hand sanitizers, gloves and face masks to help prevent the spread of COVID. So we issued them with these homemade buckets made in Sierra Leone locally from another organization who is campaigning like ourselves to end FGM. We took it to them because across Sierra Leone, the Avoline that you can see, the they call it jerry can, the 5 jerry can, it's common across all households for buckets and for fetching waters. So we bought these from those other campaigners to take it to each household across communities and help them understand how they could help present themselves and prevent themselves from catching or spreading the COVID alongside our messages on ending FGM. The next slide, please. Right, just like I would give a quick comparison to how COVID affects our work in terms of just like Ebola. You could see, although Ebola is the symptoms are so different, but they're very, very similar. Schools were closed, just like in Ebola during the COVID. And every household was forced to observe social distancing. This is across the whole of Sierra Leone and announced by the government. And again, like in Ebola, the government did put all these things in place. They quickly stopped all traditional practice, which include FGM. So this is where Anne-Marie was talking about how I talk about the government put a ban to FGM. There is no, this is not permanent, it's a temporal ban, just like they did during the Ebola, because they realized that it's through by gathering and it's through by churching that we can spread this virus. So the government was quick to respond in that way. So we're just hoping that the government would continue in this line, to see the risk which is involved in this kind of practice as well. So like I said, every household was forced to observe social distancing. Community members were kept away from other community members. Like everybody have to stay within their household as well. So like I said, the prevalence of FGM, we see a reduction in that. We did not see a lot of cases arising, like you've just heard my colleague was saying in Nigeria. It's the opposite. In Sierra Leone, because every activities concerning cultural practices were stopped. And for Sierra Leoneans, you have to go into the bush for you to go to FGM. So all of these activities were stopped by the government. So that did not say that the practice is not going on. We would know later on, but on the other side, there was a big increase on sexual violence, rape cases across Sierra Leone. And that was very similar to Ebola as well. You know, we see girls as young as 5 being raped by their family members because they were all stopped from going to school. There was no community gathering, and they were all stuck at home. So we see a lot of those cases. Just like last month, a girl died as a result of rape, you know, and she was only 5 years old. And there's alleged that she's raped by a family member who happens to be a brother. So all of these issues are the issues we face now. So it's just kind of like putting a lot of pressure on the work we do, because you have to, like, when you go to talk about FGM, there are issues like domestic violence and rape within this community you cannot ignore. You have to deal with them in public signposts. And more than ever, we are even more determined to continue our advocacy and to create safe platform, you know, to be able to have this conversation and to call out for the full abandonment, total abandonment of FGM across Sierra Leone. Because like now, we know that the cutters who are the sewers in Sierra Leone have not been in practice. Their only source of income is by cutting and initiating girls. So very soon, as the government have just recently announced that by the 22nd of July, everything is going to go back to normal slowly. So all of things are beginning to relax. So the best thing they would do, and the first thing they would do, is to begin to arrange on how to cut girls as usual. So we have to be vigilant, and we have to be very, very on point in our advocacy, and very, very stay focused in what we want to do. The next slide, please, the last one. Yes, I also see there's a need for we to share our learning experiences over this COVID and how we deliver our work, especially across West Africa, because seeing my colleagues here from Nigeria, from Gambia, and then we have other colleagues across West Africa like Senegal and Liberia. All of our cultural practices are very, very similar. So we really, really have to find a way of sharing learnings from this COVID. Again, bringing Ebola on board. What have we learned, and how can we share best practice to come together as West Africans to keep this practice out of our continent? Thank you for listening.
Wow, thank you so much, Sarian. I think, yes, people are clapping, I see. It is really, really interesting what you're sharing. And you know what? This information you cannot find anywhere. There are sometimes journalists writing down, articles in local newspapers, but it's really hard to find this type of information. So thank you so much for sharing those. I now would like to move to the last speaker of today, Oumie Sissokho. I hope I pronounce your name correctly. Yes, okay, good. Oumie is the Partnerships Manager of the Girls Agenda in the Gambia, but perhaps you can introduce yourself as well, Oumie, and we look forward to your presentation. The floor is yours.
Thank you very much, Anne-Marie. Thank you very much, AmplifyChange, for this opportunity. Thank you very much, my sister Sarian. Thank you, Chioma, and thank you everyone who has made it to this discussion today. I am Oumie Sissokho, and I am a co-founder of the Girls Agenda and also a survivor of female genital mutilation. And I'll quickly take you through the work that we've been doing during the COVID on FGM and how it has actually affected our work and how we're willing to learn in order to get used to the new normal, not impacting our work that we continue to do on behalf of women and girls and other marginalized groups in the Gambia. A state of emergency was quickly announced in March 2020, and its enforcement, like in other places, means schools were closed, informal social networks that benefit women and girls especially were no more as available as they used to be, and there was a systematic breakdown of accessibility to certain services such as medical, such as legal, such as law enforcement, etc. As people are forced to sit down at home, institutions also have to maneuver their way of how they serve their communities, meaning sometimes formal institutions, especially in the public sector, are no longer as available as they used to. Therefore, issues of gender-based violence, be it domestic violence, be it FGM, be it sexual violence, wholly become the responsibility of the civil society once again. So we do not have like thousands of COVID cases as in other countries, but at least there were 64 confirmed cases as of July 9th, 2020, which doesn't actually mean that social life in Gambia is not impacted as much as in other places. The social distancing policy, the school lockdowns actually have more impact on children and women than other genders. However, the public sector, the government, is not able to maneuver or to deliver to these new realities and expectations as expected because of issues of expertise, because of issues of funding, because of issues of inadequate enforcement of policies and laws against gender-based violence. So the responsibility, once again, as mentioned earlier, became overwhelming on the civil society. So there was a creation of a COVID response team to address the pandemic in the country, and it is very multi-sectoral. Unfortunately, there was no specific GBV response plan from the government, especially from the Ministry of Health responsible for the coordination of the COVID, in addition or in consultation with the national agency responsible for disaster management. So the government, however, recently launched the first ever GBV hotline in the Gambia, and we're hoping that people will react positively to utilize the hotline in order to report cases of GBV. However, there is a growing public perception that the hotline is more for intimate partner violence, and people are likely confused about other issues of gender-based violence, such as FGM and sexual violence, how to use this hotline to report cases. And this is an emerging need that we need to address, but we will do that later, not now. We move to the next slide, please. Okay. So the COVID has obviously affected our work, as others dwelled on. I will not go into that. Our physical interactions in the communities have been seriously affected because of the closure of the office. Also, our youth safe space, that is a safe space where young people come together to learn about SRHR and also research about GBV issues. We are not able to do it because of the social distancing policy. Technically, we paused the implementation of our annual work plan. We canceled all FGM awareness raising or advocacy activities that involve physical interactions in the communities. And our staff have to stay at home, plus our interns, in order to do the work, but within a very limited logistics system where we depend on donors to do the work that we do. And okay, sorry. With internet connection, lack of technological gadgets for all the staff or the interns or the human resource involved in the work. So we have those limitations that affect the delivery of the work that we do. But I must say that we have managed with the little that we have in order to continue the work that we've been doing. Next slide, please. Opportunities that came out of the COVID. The expansion of our virtual programming and integrating COVID-19 into planned media activities. bringing the pandemic perspectives on SRHR, discussing the gender implications of COVID-19, and also discussing the possible increase of GBV, raising awareness and turning our social media platforms into COVID-19 sensitization platforms like Chioma discussed from the Nigerian experience. We also spend time on organizational strengthening, applying for grants, personnel capacity building such as webinars like this, searching for resources online, both grey literature as well as academic research on the relationship between pandemics or crisis and gender-based violence and relevant issues, trying to utilize the opportunity of getting some of these free materials for our staff and our interns to learn about them in order for us to know the immediate needs of our communities to be able to deliver better. So we also use the opportunity to network and learn from other organizations. We activated referral systems to partner organizations such as the Network Against Gender-Based Violence or the Action Aid International, the Gambia, which are obviously bigger organizations with more resources. Where we can't attend to a particular case of GBV or an emerging issue, we refer people to these places. Cross-border FGM risks generally have reduced because of what? Because of the social distancing and people not able to travel to other places to conduct FGM. Next, please. Current situation, the lockdown has increased the practice of FGM, even though we are not able to track every incident because we have a complicated issue where people will not come out as witnesses where there is an FGM incident in a community. People will prefer to be quiet to protect one another because they will not want the law to be enforced. They will not want their neighbors, their relatives, etc. to be punished. So we have issues like that. So it is like we're working in a very critical situation where you want to report FGM cases to law enforcement, but community members who are affected will protect their members and say, we are not going, even if you report the cases. So what we are trying to do is to create a balance. We know that there is a law and we need to utilize the law, but we also need to get the support of the community in order for the law to be successful. People taking advantage of the lockdown to practice FGM, and sometimes this can possibly involve medical workers, but we are yet to confirm incidents of this, but we are doing our on the ground research and findings. People are also capitalizing on the weak disaster response that only focus on the COVID generally and not catering issues of gender-based violence and FGM. Next slide, please. Gambia wasn't as overwhelmed as other countries regarding the Ebola. There was no state of emergency. There was an economic impact at the macro level on trade and on tourism, but not on micro and individual levels as it bordered countries like Sierra Leone. Challenges include on the ground FGM, medicalization, possible change of age cutting, and to be much earlier than even the 5 years average. Activities requiring large gatherings is not possible. Virtual platforms are accessible by the urban, young people, rich people, the elite, and mostly rural people, children, and young adults who are offline are not able to benefit from the work that we do. Restriction on travel has also caused difficulty to radio and other traditional media sensitizations. Next, please. Okay. Limited logistics for stay-at-home work, poor and expensive internet, human resource was straight, limited expertise in psychosocial support, funding challenge for FGM campaign, except that our new grant from AmplifyChange has been approved and we have started our implementation officially this month. Integration of FGM into the work that we do from a disaster perspective, prepare crisis management plans, improve the culture of disaster shelter and safe spaces in our communities, create clear communication path with law enforcement, because having the law is not enough, but it must be integrated into all TGA's FGM intervention in order for people to understand more what the law is, and also why we need to work together as a community to make the law not only enforceable, but also attractive to the communities, diversify funding sources for continuity of the work that we do, and we put more pressure on the government for prevention and response against FGM. Yep.
Thank you.
That's
so
it.
Yes, thank you so much, Oumie. That was a very excellent presentation. Thank you so much for the recommendations as well. Well done. I would like to ask all participants, if you have any questions following the presentations, feel free to press the raise your hand button if you're very familiar with Zoom, or you could ask the question, type the question in the chat box. Now, in the meantime, I have a question to the three panelists, because if I listen to your presentations very carefully, there is an increase in FGM in the Gambia and in Nigeria, but a temporary hold, like the case was with Ebola in Sierra Leone. And my question is whether you could reflect on that. Like, how do you explain that? What is the main reason? Is it only the temporary hold and the ban on FGM by the government? I think it also has to do with how the Suwais react or how communities react to that. In many countries, including in East Africa, we see that parents do see an opportunity with COVID-19. So could you perhaps reflect on what is happening in different countries? And as far as I know, Sierra Leone is now the only country in the African context where there is a temporary hold. So maybe you, Sarian, could start, but then also I would love to hear from the other two speakers as well, how they could explain that or what their thoughts are.
Yes, thank you very much, Anne-Marie, for bringing that up. I think the temporal hold, we really see that again in the case of Ebola as well. We're going to use this moment to continue to pressure the government to do something about ending FGM or bringing laws that will tie it down, because it really shows that Sierra Leone as a country, we respect the law and we follow guidance from, or we follow orders from above, you know. So everybody know that once the government say there is a ban to something, and when they come out, they mean it. Because if there's any sound of drum anywhere, when they go there, an arrest will be made and action will be taken. So we as activists, we want to continue. We want to push the government to be able to use this, you know, as an example to continue to stretch forward, because all of these crimes that are happening now, there's a diversion from FGM to domestic violence and to rape and other violence against women and girls. So all of these are interlinked. So we want to make a case for the government to actually put pressure for them to kind of like make it legal, you know, by producing bringing out a law that people will follow, you know, to say, if you caught your girls or you expose them, you know, or if you did not protect your girls, just like we have here in the UK, there's failing to protect law. So not only you cannot cut girls here, you as a parent, you have a duty to protect that girl. So we want to see that, you know. So yeah, I think for me, that's my only point. And I think there's a great need for we to push government to take responsibility, because they have their own parts to play as well.
Yeah, thank you so much, Sarian. Maybe Chioma or Oumie, do you want to react on that as well?
Thank you, Anne-Marie. Just so to compare FGM cases in the time of Ebola and in this time of COVID-19, I can think of two reasons. During the time of Ebola, type 1, FGMC type 1 was prevalent. Now, that's that meant, yes, TBAs were the main FGMC practitioners. Now, in this time of COVID-19, we've noticed FGM type 4 is prevalent. There's been a shift from type 1 to type 4 over the years, mainly because of the increased cases of death, and secondly, because of the Violence Against Persons Prohibition Act that was enacted in 2015. Now, in this FGMC type 4, it's not only the TBAs that are practicing FGM. We have the grandmothers, you have the mothers, you have the mothers-in-law. So when, yes, during Ebola, there was shutdown, everyone stayed at home. During COVID-19, everyone stayed at home. But the difference is during Ebola, the TBA would have to visit your home. But now we have COVID-19, even the mother can stay at home and perform FGM and no one would know. So yes, there was increase in both cases, but the rate is much more at this time of COVID-19.
Thank you, Chioma. That is really, really interesting. Oumie, do you also want to share your thoughts?
Okay, comparing the COVID with the Ebola.
Yes, and also reflecting on the fact that in Sierra Leone, because the webinar is about countries in West Africa, and we clearly see here a difference between Sierra Leone, Nigeria, and the Gambia. So your reflection on that difference, that there is an increase in Nigeria and the Gambia, but a decrease in Sierra Leone.
Okay, yeah. So from the perspective of the Ebola, there cannot be a comparative experience. Nonetheless, what we are learning from the COVID is that when social networks break down, whether they are formal or informal, that are supported by the civil society and grassroots organizations, communities tend to go back to their normal patriarchal behaviors that undervalue the rights, the well-being, and the dignity of girls and women. So now when everyone is said to stay at home, when home is not safe for that girl, for that daughter, for that woman, or for that wife and mother, and there are no more youth safe spaces, for example, like the ones we run, where young people or girls will come and talk about incidents of sexual violence or improper touching, or having heard stories about FGM in their families and how we can respond and react and provide them with information that they can take back to their families. Then these girls or these children do not have any other person to speak to, and they tend to live either with the direct threat or the indirect threat through psychological or mental trauma and things like that. We know that those issues exist, and people have been calling us, providing information about domestic violence, about in-laws, meddling into the issues of their families, trying to grab children to take them through FGM, etc., etc. But now we can't provide direct support sometimes because of the lack of enough evidence, because of the lack of mobility to support our interventions into these communities, and sometimes also you are not allowed to visit a particular family because of the social distancing policy. Do not go there when you don't live there. However, how is our security sector, especially law enforcement, the police, prepared to intervene in some of these critical issues? Because law enforcement is not set up in a way that it will react or respond to increased GBV incidents during the pandemic. That is a lesson that we have learned, and we must communicate this very clearly to the government. Issues of media activities, for example, in some countries or in some communities across the West Africa, someone just gave feedback that like there was in fact increased radio sensitizations, and why not in our case in Gambia? Number one, mobility issues. When our staff and our interns can't get public transportation to travel to communities with radios, we don't have our own media outlets as organizations. We wish we had them. We were going to use that opportunity to keep messages flowing on GBV in a pandemic for 24 hours within the day. Also, it boils down to funding and resources, because some of the commercial radios won't just do it free for us. We have to pay, and when we don't have that money, that is why we resorted to the use of social media to do most of our media sensitization. The relationship of COVID and sexual violence, COVID and FGM, COVID and menstrual health, COVID and intimate partner violence, etc., etc. However, there was a limitation because we were focusing more on the elite with access to the internet and electricity, and not the rural dwellers who are sometimes mostly affected by FGM.
Thank you, Oumie, and thank you also for reading the chat box in the meantime and answering that question straight away. So thank you so much. I really enjoyed this discussion. It's so fascinating and interesting. We also have one participant from Liberia, Nowai Ida Kaiser. If you are still with us, I would like to ask you to unmute yourself, and it would be great if you could also share your experiences and maybe ask your question live to the panelists. So are you with us still? Nowai Ida Kaiser, you shared information about Liberia in the chat box. And I want to give you the opportunity to also share with the larger audience what the situation in Liberia is like, if you're still there. If not, I see that Beatrice Bokaye Yadom raised her hand. So if you have a question, feel free to unmute yourself and ask that question. So Nowai or Beatrice?
Thank you very much.
Hi, Beatrice.
All the participants. I just want to find out, in the light of the COVID-19, how do we ensure that we do our work very well, but at the same time are taking our safety and the safety of our team into consideration? I know that this work is very, very important, but we must stay alive to be able to do it even better. And so I'm just trying to find out how we are doing that. Thank you. Yeah. And also what the effect of the digitalization have had on their various organizations as well. Thanks.
Thank you, Beatrice. That is a very, very important question. Yes, there are also people clapping their hands. I think it's very important to spend a few minutes reflecting on your remark. Is there one volunteer of the panelists who want to start addressing that question? I think it's crucial to think about your own safety, to think about the safety of the people working with you. The work that you do is super important, but at the same time, there's also a risk, especially in times of crisis. It would be great if you're willing to reflect on that and share your experiences. Oumie, please go ahead.
Yeah. As a young organization, most of our human resource are young people, very, very young people. And the eagerness of these young people to continue the work that we do, even during a crisis, had to come to a stop, because you can't keep fighting for what's right if you are not okay yourself, if you get COVID or you are sick somehow. So we had to quickly put in place health policies internally to reduce the spread of COVID among our human resource. And we have to also take drastic measures, for example, on a particular nursing mother that we have in the organization, even well before the closure of the office or the announcement of a lockdown, national lockdown. So what we did was, we're like, okay, we are championing women's rights. And this also has to do with children's rights. Both go together for us as an organization. As a nursing mother, what we are going to do is, either you have limited hours spending in the office, or you are not coming at all and we will be teleworking with you, or you can come to work, but you will not bring the baby. That's number one policy. Even though we had never had to do this, because this is the first time, but we had to take action and say that the baby is also at risk, even though we don't have all the scientific information, but to create that gender balance, to make sure that someone understands that it is not only about her and the work, but also the well-being of her child is important. And we think this is the best practice that we can share with other organizations. Number two, we also made it a priority that any information that some of us saw online who are outside of the country, because we have better internet, is it from the UNFPA, from World Health Organization, from the government of the UK, for example, we send it back to our people on the ground and say, learn about these things and teach yourselves, and we know what we're going to do. Critically also, I want to say the contribution of donors is really important. The type of donor you are working with, the flexibility of the donor, the mindset of the donor, the ability of the donor to understand the circumstances that we operate within and quickly gather grantees in order to realize the new norm or the current crisis and help us adjust to this. I must say that at least in the case of AmplifyChange, that really reinforced our relationship and our trust in the donor grantee relationship, where the donor is not seeing itself as the supervisor providing the funding and having ultimate control over the organization. So there was a sense of tolerance and mutual respect. The donor providing the flexibility and saying, let's do this and that and that. It will add value to the work that you are doing. Can we learn from you? What are the issues you are facing? How can we support you as a donor? So this happened, and to be honest, it really helped us. It boosted our confidence, it boosted our trust, and it gave us a sense of direction where donors expect us to go, considering the reality on the ground. And I must say that it was really helpful in our case.
Yeah, thank you. Thank you so much for sharing that. And I must say that I 100% agree with you. Sarian, maybe you would like to reflect on that as well.
Yes. Just to add to what Oumie have said, in our case, most of what she just outlined, we really did. But in terms of really safety for ourselves, because going out, like we have to really go out on the ground to deliver our work. Although we were limited in the amount of people that usually go out to deliver was reduced drastically, you know, but we have to make sure that we were fully dressed with our gloves, masks, and face masks, and, you know, hand sanitizer, and constantly washing our arms, you know, for everywhere we go. And then, as we cannot offer most of our beneficiaries face masks because we cannot offer, it's very expensive. So we just make sure that our team, when they're out there, they all have PPE kits and they're well dressed and covered, and they make sure they observe social distancing while delivering our services. That is very, very important, because we all have to go back to our families. And when you go back home, we also get into the habit of taking off our clothes and wash our hands properly before we interact with any of our family members.
Thank you, Sarian. Thank you for sharing that. Chioma, you're back. You want
Yes.
you want to react as well, please. Go ahead.
Yes. So thank you, Beatrice. That was a very good question, because for us, to be honest, some staff were hesitant to still be at the front line. So we had to do a lot of reshuffling. We had to do a lot of retraining. And we had to stagger work times. So we have people that work from 8 to 12 and people that work from 12 to 4. And another thing we did was at the community during project activities, while we are sending reminders to community members that we have an activity, we tell them, come with your chair, right? So you don't have to think about where you're sitting, if it's safe or not. You're coming with your own things, you're coming with your own chair. And, you know, we've been sending SMS blasts on how to make your own kit. So we don't have to, we're not buying the facial mask. You already make it in the house. So it's part of our reminder messages to people. We tell them how to make their kits, remind them we have a project activity, come with your self-made kit, come with your own chair. And we as well, we have our foldable chairs that we go with now. So we don't have to think about cleaning the chairs and, you know, having to worry about that. So that's one way we have done that. also our End FGM advocates who've been training in communities. Most of the key influencers are above the age of 40, and very few are youths. So we're engaging more with the youths amongst them who are less vulnerable to COVID-19, if I may say. And we're telling the older folks to take the back seat. You know, yes, you would still influence people within your circle of influence, but to actively advocate at this time, we don't advise it. So we're working more with youths. We've staggered our work times, and we've done some reshuffling to ensure that everyone is safe. Thank you.
No, thank you for sharing that. And that was also one of the reasons why the previous webinar was focusing specifically on the youth, because I wanted to highlight that as well. So thank you for sharing. Lawa Drame, I see you are raising your hand. Do you have a question to one of the participants? If so, please feel free to unmute yourself and ask your question. If not, there is another question about COVID-19 messaging. I think it was mentioned by a few of you during your presentations. So you presented, and this is also something other activists presented in previous webinars, to include FGM in COVID-19 messaging. Now, the question is how exactly you do that. So could you give some practical guidance on how you do that, is one of the questions. Who wants to react on that? Chioma, please go ahead.
I will quickly try to share some messages. If I have the posters with me, you go ahead with the discussion. Let me do that, if possible, please.
Yes, please go ahead. Chioma, do you want to share how you include FGM in COVID-19 messaging?
Yes, absolutely. So we have our SMS campaign where we send out weekly messages to community members, telling them, reminding them of their commitment to end FGM in their community. Now, when I say including COVID-19 message, so it's an awareness message to say to say, remember, social distancing means staying at least 3 meters apart. Remember, to make your social mask, you need a material. We list the materials you need. You need your material. You can use a rubber band, and we say the 3-4 steps along with it. Now, sometimes this goes into more than one SMS. So what we do, we send out the End FGM messages in the morning, and we send out the COVID-19 awareness messages in the evening. And sometimes we also alternate it so that it doesn't get boring for the people that are receiving these messages, right? For some communities where we have the contact persons that use smartphones, we send our video animations on how to make this facial mask, and we have gotten community reports that some of them have actually used it in training their households to show them actually what we have been sending over SMS. So it's all about, you don't have to send it together with the End FGM message. That's what I'm trying to say. You can send it one after the other, but the idea is that it's consistent, it's a unified message, and it's coming from you. It also builds trust and commitment from you to the communities you serve.
Thank you. Thank you for sharing that. Sarian, I see you raised your hands, please.
Yes, well, the way we align the messages is just like part of our housekeeping. Like when we go out into communities to work, the first thing we do is to observe the settings and prepare the space in the event space, or where we're going to do the awareness raising activities, which we go into the communities to do. to make sure that there's social distancing observed, and like people are wearing their face masks, because if you wear your face mask and someone else is not wearing their face masks, you're not protected and you're not protecting them. So it's more active when both of you are protected and you observe social distancing. So when I say alongside our end FGM message, our end FGM message does not change. We go with our same message to end the practice into the community as we have planned our activities. But before we go into our messages, we just observe the social distancing and make sure that people are wearing their masks and gloves and they're seated apart, observing 2 meters at that time, observing that 2 meter distance. So this is what we mean by bringing along the message, our NFJ message. And then just before you move into Oumie, someone is just asking to elaborate a bit more on type 4 FGM. Yeah. That's come to my mind as well, because it's very, very broad. It's not like as simple as type 1, 2, 3. So if Chioma probably afterwards would elaborate for us a little bit on what category in Nigeria that their communities have moved on to type 4. Because in types of type 4, there are different categories. Thank you.
Thank you, Sarian. Thank you so much. Oumie, do you want to reflect on the messaging, or do you need a bit more time?
It's all right. I'm trying to share with the audience in case people want to learn how to do this. It's fine. I'm trying to send the information and a colleague will just share it here. Okay. I just want to say that there should be a sense of consistency and continuity. We are against FGM before the COVID. We are against FGM during the COVID. We are against FGM after the COVID. No matter what circumstances are being brought by this crisis, we can't underline or we can't undervalue the important work that we need to continue as civil society activists, as grassroots leaders. One important thing that we have learned from the process is that people who do not usually consider themselves as supporters of the NFGM movement are always learning from our work. They're always following what we are doing, and they are also quickly adapting to our strategies, sometimes to negatively counter what we are doing. And as activists, we should always understand that these things happen, and no matter how well we are doing, opposition is still widespread, especially in our own context, where we will use the social media as a platform to send out our NFGM messages. And pro-FGM populations will also use the same platforms, targeting similar audiences to put across their pro-FGM messages, mostly backed by their religious beliefs, their cultural beliefs, etc. So what we've been trying to do during the COVID is to gather as many young people as possible, both within TGA and the people that we work with, to get information from them regarding ending FGM, ending sexual violence, ending child marriage, and other issues of intimate partner violence, and integrating these messages into our work and showcasing that we are not the only ones actually championing these values, but other young people also want to see an end to gender-based violence, and they are supporting our work. So it's like, I wouldn't call it a media war, but it's like sometimes we compete for relevance, we compete for platforms, and this is a reality, and we must also learn how to deliver better. If our messaging is not consistent, sometimes it's not attractive to our audience, and sometimes there is a breakdown between us and the people that we serve. Because when we leave the work that we are doing because of the COVID, for instance, we are not integrating the COVID into our work. FGM into the COVID response. Okay, our work of FGM and then FGM into our COVID response. There will be a gap, and people will think that, oh, maybe it is no more going to be an important thing. Probably the COVID has overshadowed everything, and this will be the new reality in the world. No, COVID has increased gender inequality. It has just shown how social inequality is an issue in our communities. It has also shown that when young people gather together, we band together, we network and partner together. Obviously, this will be the generation that can end FGM, child marriage, and other harmful traditional practices. And we have consistently shared those values and expectations in our message.
Thank you. Thank you so much for sharing that. All the things that were shared in the chat box, I will share them as well to all participants in a mail after the webinar, together with the recording and the PowerPoint slides. So thank you for sharing those. I think we can speak for another hour or two, but time is running out. I would like to address one question, and I saw, Chioma, that you addressed that question already in the chat box, but there are some follow-up questions in relation to type 4. So as a very last question, could you please reflect on type 4 FGM in the context of Nigeria, please?
Thank you, Anne-Marie. Yes, so FGM type 4 is very common in Southeast Nigeria. In Southwest Nigeria, we have FGM type 1. So there are the different forms of FGM are spread in the 6 states that have the highest prevalence of FGM. Now, in Imo and Ebonyi states where we work, FGM type 4 is prevalent. There are no resources that can provide more information on type 4 because we have different versions of it, even in the same state or the same district, just to bring it in context here. Now, in Ikeduru community, right, in one of the communities where we work, the type of FGM type 4, the practice is that they use hot concussion on the female baby every single day, morning and night, until the FGM practitioner, that could be the mother-in-law, or the TBA, is satisfied that the genital is numb, it has no sensation anymore, and yes, they've actually achieved what they want to achieve. In another community where we're working, they use powder. Now they rub the vulva vigorously and painfully, I must add, every single day, until they're also certain that they have achieved their aim. So we have been collecting a lot of data, and one of our targets for this year 2020 is that we're going to be sharing a resource that will provide information on type 4 in Q4 of this 2020. So I'll be sure to, we're going to be sharing it with AmplifyChange. We're going to be sharing it on platforms like yours and on social media. Yeah, we want to not just type 4, but we want to talk about infantile FGM, which is the practice of FGM on female babies. A lot of information is out there about women 15 to 49 years, but for us, that is information of the past, because presently the babies, they are performed on babies. Mm-hmm. Now, yes, Sarian asked if there are any deaths with regards to FGM type 4. We have not been able to link any deaths, because in type 1, you see the baby bleeding, you see the baby dying. Now, for type 4, because the hot concussions are corrosive, we don't know what happens years after, we don't know what happens weeks after or months after the baby has undergone FGM. One of the things we have done is we have monitoring groups in healthcare centers, and on immunization days when they're taking weights of babies, they have been monitoring cases of FGM for us. And most times the reports they've given us is FGM type 4 before their first immunization. And that is where we have been focusing our attention. But with what Sarian said, he has given us a new perspective, which is to actually follow through and see what happens to these female babies 1 year after, 2 years after, to actually know, what is going on in their lives. In one of the communities where we work, we have an 11-year-old girl. She has keloids, and she didn't think it was out of the normal. right? When we started working in their community and we started talking about the short-term, the long-term effects of FGM, she didn't even tell her mother what is happening with her. She came and confided in one of our staff who spoke to me. And when we asked her, she said it's been there forever, for all she had, for all her life, right? That she feels is part of how, you know, her vagina is. And it makes us to continue to confirm that most of these women that have undergone FGM type 4, they are not able to link their health issues with what is performed on them at infants. And that is really painful, and that is really sad. And that is why most of these communities that are performing type 4, which is a shift from type 1 that has happened between 2014 and now. This shift to type 4 is between 2014 and now, based on our records, right? Yeah. We have TBAs that have performed FGM as far back as 1991, who are giving us information, who have become change agents and are sharing their stories of change. So those are some of the ways we have tried to inspire communities to abandon FGM. And I'm sure when we're able to put together the data we have, we should be able to share something later this year. So for now, yes, that's just to shed a small insight on type 4.
Well, thank you. Thank you so much for that clarification. It is really important to have more knowledge about type 4 FGM. I think a big misconception among many people within the field, but also outside, is that type 4 FGM is not harmful, which is wrong. This assumption is not correct. And I can share with you that I was in the clinic of Dr. Pierre Valdez in France. So he does perform reconstructive surgery for victims or survivors of FGM. And then he told me that he also operated women who underwent type 4. Well, many people would say, well, you know, type 1, 2, and 3, that is harmful and type 4 is not. And then Dr. Pierre Valdez clearly explains that also women who undergo type 4 has damage to the nerve system. And sometimes he says, I would qualify this type of FGM that was done to this woman, for example, women in India and Asia, in the Asian context as well, as a type 2. Looking at the harmful consequences. So I'm very happy to hear that you're going to share data and to share a report or information, because I think it is crucial to do that. So thank you for doing that. All right, we came to the end of this webinar, although I could speak for another hour with amazing activists like you and also such an engaging audience. Although we are well over time, we still have more than 40 participants with us, so that is amazing. I would like to, before we close, I would like to draw your attention to this survey of the Global Platform for Action to End FGMC. We took the initiative to, apart from this webinar and interviews that I conduct, to also collect data on the impact of COVID-19 on our efforts to end FGM by a survey. So I will share the link with you as well. And it would be great if you could fill in the survey and share with us your experiences. And then I would like to thank you. First of all, I would like to thank Alethea for contacting me and bringing me in touch with 3 amazing activists. Well, Sarian I already knew, but Oumie and Chioma, it's really nice meeting you. Thank you so much for sharing your experiences, your valuable contributions. And thank you for collaborating today with us. And I would like to wish all participants a very good rest of the day. Thank you so much. The next webinar will most probably be about the situation in the Middle East. I have some contacts in Saudi Arabia, in Oman and Iran. So most probably we have 3 activists from those 3 countries. The date is not yet confirmed, but please stay with me and follow the updates. So thank you so much. Have a good rest of the day, and I hope to see you next time again. Thank you so much.
Thank you.
Thank you for having us.
Thank you. Thank you.
Bye-bye.